Good afternoon, ladies and gentlemen. My presentation today is called Bringing Understanding to Havana Syndrome and Anomalous Health Incidents. When making this presentation, I realized that Havana Syndrome is uniquely fit for the forensic medicine webinar because at its core, forensic medicine is investigative medicine. So I came up with three investigative tracks for this phenomenon. So we're going to investigate how Havana syndrome and AHI should be understood, or in a way, what they are. And then the second track would be how this understanding can help to diagnose this novel type of brain injury and the chronic condition that results. And finally, the third track is investigation into the involvement of the intelligence agencies into the scientific research on Havana syndrome and AHIs. So let's begin with the background. Very shortly, first was reported Havana syndrome and anomalous health incidents were reported first at the end of 2016 in Havana, Cuba. However, we know that reports existed prior to 2016 and they continue currently. It was reported on every continent except for Antarctica. It was reported on U.S. soil in both federal employees and civilians. This is how the United States government suggests that they track these anomalous health incidents. They created an AHI registry, and according to the Government Accountability Office report, there are 334 victims that have qualified for medical help due to AHIs, and that included family members, including 15 children. And then there's no tracking mechanism to solidify the civilian cases that definitely exist. And the organization that I belong to, Target Justice, which is a nonprofit organization, we started a civilian registry for Havana syndrome. To our best knowledge, there are 26 civilians diagnosed with Havana syndrome, medically diagnosed, not reported, but actually medically diagnosed. And that's the difference between AHI registry and Havana syndrome registry, because AHI is simply an event. So with that, let's define what these events are. Despite the narrative by the U.S. government and the media that this is a mysterious condition, we actually have a intelligence community report on AHI in 2022, which was congruent with the National Academy of Sciences consensus report in 2020. And this is what I want to emphasize, that the common criticism is that these symptoms, the balance, the cognitive sort of meltdown, they're generic. However, the way that they occur together is unique. And this combination of the four characteristics is distinctly unusual. It is unreported elsewhere in the medical literature, and so far have not been associated with a specific neurological abnormality, a report says. And so the combination of the acute onset of audio vestibular sensory phenomena, including sound and or vibrating pressure, sometimes in just one ear or one side of the head, and then they occur with other symptoms nearly simultaneously, such as vertigo, loss of balance, and ear pain. Victims report a strong sense of locality or directionality. So, for example, auditory effect, they say we can always tell which direction the sound is coming from. And also the absence of known environmental and medical conditions that have been caused the reported signs and symptoms. Let's get to the acute episodes. Anomalous health incidents. The first report and the last report, unfortunately, from the CDC was a 2019 report on Havana syndrome, and they define a case study for this condition. It was defined as a biphasic condition with the initial phase that would contain these acute episodes, and in the period after 2 weeks after, they would consider initial phase. And then there's a secondary phase There are no AHIs being reported, and it's a chronic phase. Typically, it's a phase of progressive degradation of cognitive function. There's a much better term for AHI because it's sort of amorphous, but this is what the government wants to call it. Professor Bob McCrae in 2022 came up with a term of neurostrike, and it's much more specific. It described radio frequency direct energy pulses that act as a neurocognitive disruptor designed to harm, disable, or permanently damage a human brain. And the nature of this, because it's an energy, there's no mechanical, um, um, no objects are moving, or air blast is moving, only the energy is moving. That makes it a non-kinetic form of injury. And want to emphasize that the anomalous health incidents are not synonymous to Havana syndrome. Event versus chronic condition. So the best frameworks to understand AHI and Havana syndrome. Non-kinetic form of brain injury. What happens is that these pulses of magnetic energy are transformed at the brain level, the tissue level. It's transformed into thermoacoustic or thermoelastic shock waves. And these shock waves spread throughout the tissue, through lymphatic, intracranial liquid, and they result in damage to cellular membranes. They result in bubbling of the cytoplasm. They damage organelles such as mitochondria, and eventually produce apoptosis. And a feature of this non-kinetic injury is alteration and damage to the blood-brain barrier. On the other hand, AHIs, anomalous health incidents, should be best understood as a brain entrainment episode. Why do we have all these symptoms and signs and symptoms occurring simultaneously? So brain entrainment is actually the explanatory framework that we need to understand. It's a new novel framework. It is also known as resonant coupling into biological frequency. So the external frequencies change the biological frequency. They entrain, they couple, they synchronize. This coupling produces biological effects in the entrained tissues, and biological effects produce clinical signs and symptoms such as vibration, known as buffeting, auditory vestibular, and cognitive dysfunction. So the symptom called buffeting is actually a sensation of vibrating pressure to the head, teeth, torso, and the body. The term actually comes from aeronautics, and it describes an aircraft that vibrates when it encounters mechanical airwaves. So it's a vibration of an aircraft. Novel concept to a lot of physicians, but nevertheless, we need to understand it. This takes us to the second investigative track, which is how can we diagnose it? Despite all these multiple investigations and reports, and most of them we haven't seen, they're still classified, the best diagnostic criteria are still best described in a publication by Professor Michael Hoffer and his colleagues in 2018. It is based on 25 undisputed cases that form so-called Havana cohort of the Havana syndrome. And Professor Michael Hoffer is the head of the Department of Otolaryngology at the University of Miami. And so what constitutes a diagnosis of AHI and Havana syndrome? It's a combination of signs and symptoms during and following AHIs, and that we describe what happened. The symptoms happen simultaneously. Then you can find oculomotor abnormalities similar to post-concussive period. However, when we utilize a computerized analysis of this oculomotor function, you can actually distinguish between a post-concussive situation and post non-kinetic. brain injury. And next is vestibular panel. In the Hoffer, in the University of Miami research, they utilized three tests, and in all of the Havana cohort patients, two out of three tests were in the pathological range, meaning two standard deviations or more. And that actually constitutes injury to the brain. And finally, cognitive panels that can establish distinct pattern, and it includes both short and long-term memory degradation, difficulty concentrating, and more. Additional diagnostic criteria. So what we just discussed is sufficient to diagnose Havana syndrome and anomalous health incidents. But there's more. There are additional confirmatory tests. For example, blood biomarkers. They things like neurofilament light chain protein, glial Fabry acidic protein, ubiquitin C terminal hydrolase, and neuron-specific analyze. They're all markers of neuronal and cellular damage and the damage to the blood-brain barrier, and they would be elevated immediately after the non-kinetic brain injury, and over time, if there are no other attacks, they would over time they would come down. Next diagnostic method is diffusion tensor imaging in the form of functional MRI. This DTI method, it tracks distribution of water molecules. And in the University of Pennsylvania study, it's published in 2019, they found significant difference in white matter volume and white matter tracks as compared to the control. And finally, a method that kind of really went under the radar, but it is extremely helpful. It's called QEG, qualitative electroencephalogram with SW Loretta. It's basically, as opposed to fMRI, which is indirect, it tracks water molecule distribution. This method is a direct electric neuroimaging method. So it actually shows disruption in the normal propagation of electric signal, electromagnetic signal between neural nodes in the brain. And on the right, you can see on the top, there's a normal image of normal brain, and there's just occasional disruption of the connection between neural nodes. And then on the bottom, you see it's a global image for the brain. All these dark blue lines represent a slow delta connection, which you should not see in their awakened state. And yet, in these patients, they are everywhere, literally in every neural network. So this is a direct evidence of neural disruption when you have the connections working at the slow delta speed. Going from the diagnosis, going to diagnostic codes, what has been suggested for this is ultimately called non-kinetic brain injury, NKBI. But it is not yet in the current international classification of diseases yet. There are efforts to put it in the classification. It's worth mentioning that in the military medicine, this condition is called UBI, unconditionally acquired brain injury, and it's specifically assigned to injury due to directed energy and electromagnetic pulses. So for the civilian physicians, the following codes exist and they make sense. We have to separate it that it's not a brain injury due to mechanical forces like physical, like an object moving, or air blast is moving, or the head itself is moving. No, but it should be fall under acute brain intracranial injury other. And they're unspecified and specified codes. And I think that knowing what we know now, there's enough evidence to suggest this second code, SO6.89, and specify it as non-kinetic injury. What follows, the acute attacks, and the acute attacks can continue into the chronic phase, essentially is encephalopathy. And when you say traumatic encephalopathy, neurologists are absolutely like, well, there's no concussion. Of course, there's no concussion because it's a non-kinetic. So we should file it under encephalopathy, other specified, and explain the diagnosis that it's a non-kinetic form of encephalopathy. Why is it important? Because using appropriate ICD codes is how this condition is tracked. So they had to be tracked by the local health departments and the CDC. And with that, we're moving to track number 3. Let's talk about intelligence agencies meddling in the scientific research into Havana syndrome. Let's go back to 2016 when these first attacks were reported. Not many of us know that there was a Directed Energy Weapons Systems Acquisition Act of 2016. It's a DEWS, a DEWS. It's not just a single weapon. It's a system. It's a system that contains distributed sensors and distributed sources of electromagnetic energy. And there's a definition in this act. What is DEWS? Military action using highly focused sound, electromagnetic, or particle beam energy to incapacitate, damage, or destroy enemy equipment, facilities, or personnel. So, if we have these weapons, we created these weapons, therefore we should know what kind of effect it has on the human brain. Why send doctors on a wild goose chase to figure out what it is? Moreover, members of the Senate Intelligence Committee were sworn to secrecy for 5 years following reports on HS and AHI political reports. So after 5 years passed, they passed Havana Act. In 2021, it stands for Helping American Victims Afflicted by Neurological Attacks, and it allows for a one-time payment to federal employees and their dependents. That's it. Nothing to civilians, unless you're a family member. And it requires simply board-certified neurologists to diagnose brain injury. So that's how the Senate responded to the 5-year delay. But we need to dig deeper. So the most recent intelligence community report issued by National Council on Intelligence, there was something really, really wrong with this community report because the report conflated the fact of AHI with its attribution. So specifically, they write symptoms reported by U.S. personnel were probably the result of factors that did not involve a foreign adversary, such as pre-existing condition, conventional illnesses, environmental factors. Those are two different things. One is this real? It has basis in pathology. And who did it? So the narrative that this report has is, well, we didn't find a foreign adversary, therefore it's not a real condition. But the report did not mention those 25 patients of the Havana cohort whose diagnosis is still undisputed even by the CIA. And that's a loss. None of the journalists raised this issue in the mainstream media. One of the voices that raised this issue is DC Attorney Mark Zaid, who represents federal employees only, strictly federal employees afflicted with AHIs, and he openly calls it government cover-up. Most recently, in May of this year, at the House Homeland Security Subcommittee hearing. In another publication in September of this year, he's quoted that the CIA has consistently lied to the American public for the last several years and may be guilty of obstruction of justice, lying to the Congress, and witness tampering. So let's take a closer look at the CIA. So for example, we learned that CIA meddled in the FBI investigation into anomalous health incidents because 30 to 40%, according to the Government Accountability Report, occurs on U.S. soil. So there was a whistleblower complaint filed in January 2023 that claims that the CIA discouraged victim from speaking to the FBI, which was investigating the incident as potential crimes committed against U.S. citizens at home and abroad. And those who did speak to the Bureau were punished by the agency. Furthermore, the most recent NIH study that was published in March of this year, of 2024, it was a follow-up on The study mentioned previously, it is in the original study, there was 40 victims of AHIs and 48 controls, and there was a statistically difference reported on the fMRI, specifically DTI, and the recent NIH study expanded that of 40 patient to 80 patient and compared it to the same 48 in control. So where did this additional 40 patient came from? They didn't come from a medically diagnosed and confirmed cohort. The CIA was accused of unethical coercion of participants into the study. CNN reports in September of this year. So this dilution of the HI group resulted in skewed results. There was an IRB investigation. Further research was canceled. And this is strictly due to CIA meddling. So this is unacceptable. And there's no media backlash, which we should have. Okay, next agency that we need to look at it is the Department of Defense. Department of Defense Health Agency developed acute AHI assessment form. It's called DHA Form 244. The form remains classified, and we don't know how the form was developed and validated. And we also know that DoD has been carrying out experiments, for example, in primates and ferrets, in an effort to replicate the symptoms caused by Havana syndrome. There's a government grant with a specific number. The study was completed in September 2023, according to usaspending.gov. And we requested the study via FOIA request, and the answer said no reports exist associated with this grant. Okay, that concludes our three tracks. In the first track, we defined what AHIs and Havana syndrome are. This is a unique and novel neurological condition. AHI is an acute episode of brain entrainment to external electromagnetic pulses, and Havana syndrome is a chronic encephalopathy, a form of non-kinetic brain injury. In track number 2, we discuss how to diagnose AHI and Havana syndrome so it would be tracked by the CDC. And we suggested specific codes for acute brain injury and chronic encephalopathy. And we're expecting NKBI to be in the next classification of disorders. And finally, we have evidence of intelligence agencies meddling into the scientific research on AHI and Havana syndrome. And before I close this presentation, I would like to add one more slide. For a lot of people, they cannot accept the reality of this phenomenon unless they know why. What's the reason these people would be targeted? And I would like to draw your attention to the report of National Research Council report on emergent neurocognitive technology, which identified in 2008 degradation market in which customers were interested in seeking advantage by degrading temporarily or permanently the cognitive abilities of others. It draws a pretty clear picture of what this might be. And furthermore, experts draw attention to the fact that Havana syndrome is a part of modern-day cognitive warfare. You might know this under other names, 5G warfare, or the term omnivore has been proposed if you follow the work of David Hughes. And it's really an ongoing war waged against population at large in the cognitive domain. And yet it can target one brain at a time, most likely using artificial intelligence. And it's rooted in these advances in neurotechnology and the convergence. We know it under the name NBIC, NBIC. It's a convergence of nano, bio, internet, and cognitive technologies that made this remote degradation of human brain and torture-like attacks possible. Thank you for your attention. These are all the places where you can find me. Thank you very much.